Let's go across to Dr. Ashish Jha, K.T. Lee Professor of Global Health at the Harvard T.H. Chan School of Public Health, Faculty Director of the Harvard Global Health Institute. Dr. Jha, great to have you with us. Dr. Jha, give us a sense of how the virus is playing out in terms of this constant challenge that countries around the world are grappling with at this late stage of the rising curve of the virus, where you're locking down and you're opening up and then you're seeing the virus surge. Just look at what's happening in America, where you are right now, where states are closing down now after perhaps opening up too early. What are the lessons you're seeing there of what's happening in America and how that would also play out for us here in India?
Yeah, so thank you for having me on. We are still very early in the pandemic. The most important thing for people to remember is that we are many, many months away, probably a year or so away from having a safe and effective vaccine that's widely available. Until then, we are going to be battling this virus. And what we're seeing in the United States, which is turning out to be one of the worst responses of any advanced country in the world, is that we opened up very early. We didn't have a good plan for how to stay open. And many parts of the country we're seeing surges in cases. And I am worried that many parts of America are going to have to close back down again. And I think this is an important lesson for India, because I have been very supportive of India's initial lockdowns. I thought they were the right policy. But as India has opened up in the last month or so, we have started seeing surge in cases now, more than 20,000 cases per day. I expect that will continue to rise in the upcoming days and weeks and months. And the question is, what is India's strategy for curtailing the virus before it gets out of hand and we have to shut down large parts of India again?
Dr. Jha, I would like to understand, what are the challenges in front of doctors? Are they different in US and different in India, or the ground situation is the same?
You know, the ground situation in many ways is the same. If you're a doctor in Boston, or you're a doctor in Mumbai, or Bangalore, or anywhere else, or in Bihar, where I'm from, you're going to, in some ways, face the same set of challenges. Of course, the context is different and the resources are different. But what you have in front of you is you're going to have people who are very sick, who will be very high risk for spreading the disease to others, to other patients, but also to doctors and nurses. And we are only now identifying treatments that really can make a difference. So it's very, very critical that we support our frontline healthcare workers, nurses and doctors and others, both in how they provide care, but also really making sure that we keep them safe.
All right, sir. Thank you so much for sharing those views with us. Indeed, the situation in America is a big concern indeed.